Do you ever feel stuck or overwhelmed trying to diagnose your complex patient's true cause of their problem? Well, if that's you, give me 5 minutes and I'll show you how to reveal the exact source of their pain and how you can design a treatment plan that's going to get long-lasting results. Now, if you don't know me, my name is Dave O'Sullivan. I've worked with England Rugby Union and England Rugby League at 2 World Cups. And I've also been able to mentor 850 therapists in over 30 countries. And I'm going to show you what I've showed them that's given them confidence and clarity to have any patient comes through the door using a pro sport step-by-step treatment plan. So when a complex patient comes in, they've probably come in with a lot of things going on. This hurts, this hurts, this hurts. And it's like, right, where do we start? So what we want to do is we want to find the root cause of the problem. And it was only when I discovered that actually 90% of the information that the brain processes is visual, that's when everything changed for me. Because what happens in a subjective assessment, the patient comes in, we sit down, we face the patient and we listen, okay? And that's all well and good, but it's hard for us to be able to connect the dots to find the true cause of the problem. So with your next patient, this is what I want you to do, okay? So here's your patient now. They've come into you with this problem. I'm in pain, okay? And what I want you to do is I want you to get a piece of paper or a whiteboard. And in my clinic here in Huddersfield, every single treatment room has a whiteboard, okay? And what we're gonna do is we're gonna say to the patient, okay, answer this question. I've never quite been the same since. Okay, and I want you to pause and I want you to listen to your patient's answer, okay? And then what I want you to do is I want you to draw a timeline, okay? So when the patient says, I've never been quite the same since I've rolled my ankle or whatever, okay? I want you to plot that on the map, okay? So again, if that patient has back pain or knee pain or something now, okay, this is where they are now. Let's look at their injury history, okay? So if they'd had an ankle in, let's say, 2007, they'd hamstring tear in 2009, okay? Then 2015, they had a big stressful situation, okay, or they might have lost a loved one, okay? So then, again, don't forget the emotional stressors, not just the physical injuries, okay? And then that's when my knee started to hurt in 2016, okay? And then I've had this pain ever since, okay? Now, what you're going to do here is you're going to be able to connect the dots, okay? So you can see, okay, ankle injury 2007, then the hamstring, then something else happened, then the knee pain started to develop, okay? Now what this allows you to do is it allows you to see and connect the dots of where things may started to go downhill, and then other parts of the body may have started to overwork to take excessive load off, for example, the ankle or something else, okay? Now the other big secret about using this is as you draw this out, it's not only going to help you, the therapist, to connect the dots, but it's also going to help your patient to see it as well. So if you've ever had a patient who's, they forgot to tell you some of their injury history, and then, they didn't think it was relevant, and then 2-3 sessions in, they go, oh, I forgot to tell you about this. This is going to solve that for you, okay? So use the timeline in chronological order, step back, and allow your brain to process this visual information so that you can connect the dots and you can have the confidence to treat any patient that private practice therapists are exposed to. Now, if you want my subjective assessment cheat sheet to allow you to get all of this injury history as well as ask the patient some powerful questions so that you can design value-based treatment plans that keeps them progressing even after session 3, 4, and 5, then send me a yes, please, in the comments below, and I'll make sure I send you a message with that link so that you can have my subjective assessment cheat sheet, essentially, that we use in our clinic here, okay? So get trying this today. If you want my subjective assessment cheat sheet with all the questions that we ask in the subjective assessment, just pop a comment below saying yes, please, and then I'll send you a message with the link so that you can download that too.